Good afternoon, everyone. My name is Molly Alawode, and I'm the Director of Education here at the American Kidney Fund. Thank you for joining us for today's webinar, Kidney Chat, Ask a Nephrologist About COVID-19. For those of you in attendance who are health professionals, we are glad that you've joined us today and hope you'll recommend this webinar to the patients you work with. However, as a friendly reminder, this webinar is not accredited for continuing education credits. If you believe that your accrediting body may offer you credits for attending this webinar, we'll be happy to send you a certificate of attendance after today's session. Simply email us at education@kidneyfund.org. Before we begin today's webinar, we must start with a disclaimer. COVID-19 is an emerging, rapidly evolving situation. If you are watching a recording of this webinar, the latest information may have changed since the initial broadcast. During today's webinar, we will cover the following topics: COVID-19 and kidney disease, guidance for dialysis and transplant patients, and how you can protect yourself and your family. Now we'd like to take a few moments to address what the American Kidney Fund is doing to support the kidney community during this pandemic. Visit kidneyfund.org/coronavirus for updates from AKF and to access all of our resources like videos, blog posts, and FAQs. Additionally, AKF launched a coronavirus emergency fund, which provides $250 one-time grants to kidney patients in the U.S. affected by coronavirus. If you are able, please consider making a gift today so that we can provide grants to over 2,000 patients on the waiting list who need transportation, medication, and food to survive. 100% of all donations will go directly to patients in need, not to overhead. Dialysis and recently transplanted patients may apply. We will approve all applications in the order in which they are received as new funding becomes available. Visit kidneyfund.org/coronavirus to learn more. Without further ado, allow me to introduce today's speaker, Dr. Maria Clarissa Tio. Dr. Tio is a clinical and research fellow in the renal division of the Brigham and Women's Hospital and Massachusetts General Hospital's Joint Nephrology Program. After graduating from the University of the Philippines in Manila and the Duke National University of Singapore Graduate Medical School, she completed her residency in internal medicine at the University of Texas Southwestern Medical Center in 2018. Most recently, she was awarded research funding through the American Kidney Fund Clinical Scientist in Nephrology program. She is also pursuing a Master of Public Health degree from the Harvard T.H. Chan School of Public Health. Thank you, Dr. Tio, for joining us.
Thanks for inviting me.
So now we will begin our question and answer session. We asked attendees to submit their questions in advance of today's webinar. We will now address some frequently asked questions related to COVID-19. So our first question is, what do all these buzzwords mean? Over the past few weeks, we've heard terms like social distancing and flatten the curve, but what do they really mean?
So coronavirus is actually the name of the virus that causes the disease COVID-19. The scientific name of the virus is Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. COVID-19 is the name of the disease that the virus causes. So it is short for Coronavirus Disease 2019, and it usually manifests as a respiratory illness with flu-like symptoms. So the next buzzword that a lot of people are talking about is social distancing or physical distancing. So it basically means that we are increasing the physical space between us and other people outside our home to stop the spread of disease. So there are a couple of ways that we can practice social distancing. For example, avoiding social gatherings, avoiding crowded places, keeping a 6 feet distance from others when we are in a public space, working from home if we are a non-essential worker, and using delivery services. And then we also hear the words quarantine and isolation. So quarantine means that we keep someone who may be exposed or who might have been exposed to the coronavirus and who is at risk for COVID-19 away from others. So it involves staying at home for 14 days with self-monitoring, and that includes checking temperatures twice a day. So one setting where this would apply, for example, is if you just returned from travel and you are placed on quarantine to monitor your symptoms to prevent the rapid spread of COVID-19. Isolation, on the other hand, means to keep sick people with contagious illness away from others who are not sick. So, for example, if you are sick and you are at home, you keep yourself isolated from other members of the household by confining yourself in a sick bedroom or space. One very popular buzzword these days is flatten the curve. So this is the image that basically explains what flatten the curve means. So a curve is basically the shape or distribution of data. In this case, you can think of it as a shape of a hill. So if you look at this figure, we have two hills here, or two curves. One of them is tall and pointy, and the other shorter and more gradual. These hills or curves represent two possible scenarios. So in the pointy red curve, as you move from left to right along the graph, and this represents time, you can see that the hill spikes up, which represents a rapid rise in the number of new coronavirus cases. You can see that the peak goes much higher than the dotted line, which represents the maximum number of patients our healthcare system can take care of at one time. If the coronavirus trend follows this scenario, then we are in big trouble. The second curve, the blue one, is what we want to happen. This is where the rise in cases is slow and we never go past that dotted line. It is important to realize that in both curves, the total number of patients infected may still be the same, but what's different is how fast people get infected. The best way to slow down the rate of infection is to practice the social distancing and quarantine measures that I have mentioned. If we get into a situation where too many people are too sick too quickly, then the healthcare system can collapse, and you'll have people who need medical equipment and medical attention who can't get them, and this will cause people to die.
Thank you for that great explanation. So now we're going to get into some of the questions about COVID-19 and kidney disease. So let's look at our first question. It says, I was recently diagnosed with stage 4 chronic kidney disease. Am I at high risk for COVID-19?
So one of the dangerous things about this disease is that it is extremely contagious regardless of who you are. Young and old, sick and healthy can potentially get this disease and spread it. Because this is such a rapidly evolving disease, what we know now is limited. For example, we are just starting to learn about the risk factors for severe COVID-19 infection. So the CDC has laid out some known risk factors for severe COVID-19 infection. For example, persons who are age 65 and above, or persons who are resident of nursing homes and long-term care facilities, they are at high risk. Generally, we also found that patients with chronic diseases are at a higher risk for getting more severe forms of COVID-19. For example, chronic diseases include chronic kidney disease, diabetes, and high blood pressure. So there are some things that we have to point out. For example, transplant patients or patients who take drugs that suppress their immune system are known to be of high risk. There is also concern of whether living donors could be at a high risk, and right now we do not have any evidence or data that can point us to one or the other. So we just advise our living donors to practice all the precautions that we will be mentioning later on as recommended by the CDC, unless they have other chronic conditions that may put them at a higher risk.
So going off of that question, somebody asked, why are kidney patients at higher risk?
So at present, we do not have any specific data that will pinpoint the exact reason why kidney patients are at a higher risk. However, kidney patients are usually older. A lot of them actually have coexisting chronic conditions, and these themselves may contribute to the risks of these patients.
Great explanation. So since we're dealing with a new coronavirus that's still being studied, what do nephrologists know so far about how coronavirus impacts kidney function?
So some things that we know. First is that there is a risk of acute kidney injury that's seen in patients who are hospitalized for COVID-19, especially in those who have severe forms of COVID-19. So not all severe COVID-19 cases, however, develop injury to the kidneys. Some of the COVID-19 patients who develop kidney injury would need dialysis. There are some contributors to kidney injury. For example, low blood flow to the kidneys when the blood pressure becomes very low with more severe forms of COVID-19. Two, the intense systemic inflammation that happens in some severe COVID-19 cases. In very rare cases, muscle breakdown occurs, which can contribute to kidney injury. And also, there are suggestions of the virus attacking the kidney itself, and this is currently being studied.
Well, that is really good to know. Our next question is, are there any other symptoms besides cough and fever I should look out for?
Since COVID-19 is a respiratory illness, the common symptoms include sore throat, nasal congestion, unexplainable feeling of discomfort or illness, headache, body aches, and in some cases, loss of sense of smell or taste. There have been reports that the symptoms that dialysis patients who have been infected with COVID-19 experience are actually more atypical. For example, nausea, vomiting, diarrhea, and even low-grade fevers. So if you think that you're starting to get sick and your symptoms are a bit atypical, it's best to look at the CDC self-checker tool, which we have included as a link in this presentation, but more importantly, call your doctor immediately to discuss your concerns.
That's great advice. So our next question is, should CKD patients do anything differently than other patients if they think they have COVID-19?
Some advice that I would give to CKD patients would be first, as I mentioned earlier, if you think that you're developing some symptoms, contact your doctor immediately to figure out if this is something that you can monitor at home or if you have to go and seek medical attention. So your doctor may tell you that you are well enough to monitor your symptoms and manage your care at home, but your doctor will also determine whether you need to change some of your medications because you are sick. So for example, if your doctor has determined that you are well enough to take care of yourself at home, here are some things that you can do. So first, always keep in touch with your primary care provider and your nephrologist and update them if there are any new symptoms that are happening or evolving. Second, call your doctor if your symptoms get worse. So one should be very familiar with the emergency symptoms for COVID-19. These include trouble breathing or shortness of breath, chest pain, totally being unable to eat and drink. And the other members of your household should also be familiar with these symptoms if they start noticing it in you. For example, confusion or having a bluish color in the lips and face. When you're at home and self-medicating and monitoring your symptoms, You also have to limit the spread of the germs or of the virus to other people. So avoid sharing personal items like cups and towels, avoid touching your face, clean and disinfect surfaces you frequently touch, avoid unnecessary visitors, and you should also handle soil laundry with gloves. So if you are sick and you live with other people in the house, you also have to protect them from getting sick. So when you have to go near other members of the household who are not sick, make sure you are wearing a mask. You should avoid public transportation if it is necessary for you to leave the house. And if you have a medical appointment and you have to physically go in, call the clinic beforehand to notify them that you may or may not have COVID-19 so that they can prepare for your arrival.
Thank you for those useful tips. So now we will address questions about protecting yourself and others. Someone in our audience asked, do I really need to stay indoors all day if I am not sick? What advice should I follow about staying home if I am high risk?
So yes, you still have to stay home even if your risk is low. And you always have to stay home if you are at high risk, except if you really have to leave the house for essential reasons. For example, you have to go to your regular dialysis treatments. So as you're staying home and as a high risk patient, if you need certain errands to be done, try asking others to help you out with it. It's okay to go outside for some fresh air and spend time with others who currently live with you at home, as long as none of you are sick. But just in case, it's really important that you keep a 2-week supply of your essential items and medications. Complete a care plan as part of your emergency preparedness, and a care plan document can be accessed in the CDC website. If you have concurrent asthma, know your asthma action plan as well.
Thank you for that great answer. So someone else asked, how do we stay safe and prevent ourselves from getting sick when we have to leave the house?
So to understand the current precautionary measures that the CDC is recommending, it's important to understand how SARS-CoV-2 spreads. So it's spread from person to person, and the main way is through respiratory droplets. For example, when you sneeze or cough or talk. Other ways that it can spread if you touch contaminated surfaces, and currently there's some data coming out saying that people with COVID-19 who do not have any symptoms at all may be able to spread the disease as well. So the first question is, if you're thinking about leaving the house, is first, do you really need to leave the house? And the answer is no if you are a person of high risk or if you are sick. Then you should think of ways, for example, to ask others to help you with, for example, a particular errand. Again, if you have to go out, it's necessary for you to go out, for example, go to your dialysis treatments, then do the steps that we have outlined earlier. So, but the answer is yes, and that you truly need to leave the house. Some things that you can do to prevent yourself and others from getting sick is to, one, avoid crowds. So, for example, you time your grocery visits when you think that it won't be as crowded. Whenever you're out in a public space, keep 6 feet distance between you and others. Always practice good hand hygiene and clean your hands regularly with soap and water, or at least 60% alcohol. And even though that you're cleaning your house regularly, still avoid touching your eyes, nose, mouth, and face. Clean and disinfect the items that you bring inside the house. For example, the car keys, the phones, the credit or debit cards. And there are new CDC guidelines that have come out recently. Basically, when you go to a public space, try or always wear a cloth mask to cover your mouth and nose.
Thank you. That is all so good to know. So now we'll go into the next section of questions on special considerations for dialysis and transplant patients. So our first question is, do you have any tips for people on peritoneal dialysis or home hemodialysis?
So for patients in home dialysis, both patient and family members must take special precautions apart from the standard ones that I have already discussed. So it is important that the patient has adequate home dialysis supplies and medications that can last for at least 2 weeks in case there is an issue with the supply chain or if the patient is sick and needs to self-isolate for 14 days. The patient and family members should really practice social distancing and try to stay home as much as possible. Family members should be extra careful to prevent transmitting the infection to their vulnerable family members on home dialysis. When family members have a positive contact with a COVID-19 patient or start showing symptoms, they must call the nephrologist or dialysis unit to inform them, and they should practice self-isolation at home and not share any personal items with other members of the family. Be extra diligent with hand hygiene. For the home dialysis patient, call your nephrologist or unit if you start developing any symptoms.
Thank you for that great explanation. So for people who do in-center dialysis, our next question is, what are dialysis centers doing to protect high-risk dialysis patients?
So the CDC and the American Society of Nephrology have set out guidelines to be followed by outpatient dialysis centers to protect both staff and patients from COVID-19. So here are some of them. For the healthcare workers, they are getting extra training regarding hand hygiene, proper hand washing techniques, proper coughing etiquettes, proper use of personal protective equipments. So dialysis units maintain really close communication with the health department. They also routinely clean and disinfect all equipments. For patients, the dialysis unit screen all patients for signs and symptoms of respiratory infection upon arrival. And when there are sick patients, they are dialyzed either in a separate room or farther away from the other patients in the unit.
Great. So what are some of the special precautions that transplant patients should take?
So for transplant patients, it is important that you continue taking your immunosuppressants. Do not change them. Do not change how you take them, the dosage that you take by yourself, and only change them if you are told by your transplant nephrologist or your transplant doctor. Avoid travel unless it is absolutely necessary. Immediate household contacts of transplant patients should also avoid unnecessary travel. Like the patients who are on home dialysis, make sure you have at least 2 weeks worth of your medicines, including your immunosuppressants. So try to get 90-day refills. Fill your medications at least 1 week in advance before you run out. In terms of trying to get your medications, the best is to see if you can get them ordered via mail, or if not, you can ask someone to go to the pharmacy for you or consider going through drive-through pharmacies to limit your risk. And if you are starting to show any symptoms, contact your transplant center.
So our next question is, how is this pandemic currently affecting kidney transplants?
Unfortunately, the current pandemic is truly affecting kidney transplants. So some centers have actually postponed living donor transplants, and in some areas, deceased donor transplantations are impacted as well. So call your transplant center or visit kidneytransplantcenters.org for a list of leading transplant centers and their current status.
So going off of that, are deceased donors tested for COVID-19?
So it is now standard of care in endemic areas to test deceased donors for COVID-19 before the organs are offered. The test has its caveats though, and a negative test does not completely rule out underlying COVID-19. Coordinators at transplant centers who are doing kidney transplants are providing such information to potential patients when an organ offer is made.
That's really good to know. So now we're going to go into our next section of questions. These are the other questions and fall squarely into the other sections, but still really important to address. So let's look at that first question, which is, are there any special foods I should be eating to help boost my immunity?
So there's no evidence that any specific food group that can prevent or fight off the coronavirus. So our advice is still to eat healthily and for kidney patients to continue following the dietary and fluid recommendations given to them by their nephrologist and nutritionist.
That's a great explanation. So someone else in our audience asked, can I still get emergency medical treatment for other reasons during this pandemic?
Yes, definitely. While elective procedures have been canceled, hospitals will still see patients who need treatment, whether it is a COVID-19 or non-COVID-19 related issue. So the biggest concern with pandemic is how resources are being used and the availability of healthcare staff, especially when it reaches the peak of the curve.
That's great to know. And so now we've come to our last question, which is, where can I find more information?
So the kidneyfund.org actually provides a lot of useful information, especially for our kidney patients. So I encourage everyone to go to their website at kidneyfund.org/coronavirus. Of course, the CDC website, which is run by the Centers of Disease Control and Prevention, also provides the latest guidelines on what we should be doing during this time of the pandemic. So you can go to cdc.gov/COVID-19.
Well, thank you so much, Dr. Tio, for answering all of those questions. This concludes today's webinar. This webinar was recorded and will be made available for viewing on our website, kidneyfund.org/webinars, within the next 1 to 2 weeks. When the webinar closes, please do not close your browser window. You may see a pop-up saying that the webinar has ended. Please close that pop-up and proceed to the webinar evaluation survey. Your honest feedback will help us make our webinar program the best it can be. Thank you for joining. We hope to see you again.